Welcome to the second NCLEX practice test video. Want to pass the NCLEX on your first try? Use our proven 30-33 strategy. Watch our 30 practice test videos, watch each video 3 times, and follow this plan for 30 days. In these 30 days, we'll cover a total of 4,500 questions that have been asked previously and could be asked again. In this video, we will master question numbers 151 to 225. Master all these questions and ensure your success. Let's start the video. All right, let's start with our first question. A patient with suspected meningitis is admitted for evaluation. During the doctor's examination for signs of meningeal irritation and spinal nerve root inflammation, the nurse documents a positive Koenig sign if A. Stiffness is noted when the neck is flexed. B. Dizziness is felt during position changes. C. Pain is experienced when the hip and knee are flexed. D. Discomfort occurs when the head is turned to the left. Take a moment to think about it. Remember, this sign indicates irritation of the meninges. Got your answer? The correct answer is C. Pain is experienced when the hip and knee are flexed. A positive Koenig sign is identified by pain during the flexion of the hip and knee. This sign is one of the physical indications of meningitis. It is caused by severe hamstring stiffness, preventing the leg from straightening when the hip is flexed to 90 degrees. Next question. A client diagnosed with Alzheimer's disease is being helped with daily activities when the nurse observes that the client is using a toothbrush to comb her hair. This behavior indicates the client is displaying A. Aphasia, B. Agnosia, C. Apraxia, D. Anomia. Think about the different cognitive impairments associated with Alzheimer's. Ready? The correct answer is B. Agnosia. Agnosia refers to the inability to recognize objects and their intended uses. For instance, a person with agnosia might attempt to use a fork instead of a spoon or mistake a shoe for a cup. In terms of recognizing people, this might involve an inability to identify individuals, not due to memory loss, but because the brain cannot process the identity based on visual information. Let's move on. The patient with dementia shows increased confusion in the late afternoon and evening. The nurse recognizes this as A. Hallucinations, B. Sundowning, C. Typical aging, D. Chronic exhaustion syndrome. Consider the patterns of dementia symptoms. The correct answer is B. Sundowning. The phenomenon of increased confusion and agitation that begins in the late afternoon and continues into the night is known as sundowning syndrome. This state of confusion often leads to behaviors such as anxiety, aggression, and wandering. The term sundowning specifically refers to the period when these symptoms become more pronounced as the sun sets and throughout the night. All right, next up. A client reports having a painful blister on her vulva during an initial visit. The nurse suspects the most likely cause is A. Gonorrhea, B. Genital warts, C. Herpes, D. Syphilis. Think about common symptoms of sexually transmitted infections. Ready? The correct answer is C. Herpes. Painful blisters on the genital area are typically caused by a herpes infection, which can be either primary or recurrent and is a common sexually transmitted infection. Herpes genitalis manifests as painful blisters or sores. Next question. A doctor prescribes Exelon, also known as rivastigmine, for a patient with Alzheimer's disease. Which side effect is most commonly linked to this medication? A. Urinary incontinence, B. Nausea, C. Confusion, D. Headaches. Consider the common side effects of medications for Alzheimer's. The correct answer is B. Nausea. Exelon, like other acetylcholinesterase inhibitors, often causes gastrointestinal side effects, including nausea. These effects are particularly prominent during the initial dose adjustments, but can be mitigated by slow dose increases and taking the medication with food. Gastrointestinal upset, including nausea and vomiting, is very common with ribostigmine, especially during the dose escalation phase of therapy. Let's move to the next one. A 15-year-old in her first pregnancy is admitted with suspected HEL-P syndrome. Which lab result would support this diagnosis? A. High blood glucose. B. Raised liver enzymes. C. Elevated creatinine clearance. D. Increased platelet count. Think about the key indicators of HEL-P syndrome. Ready? The correct answer is B. Raised liver enzymes. HEL-P syndrome is characterized by hemolysis, elevated liver enzymes, and a low platelet count. Elevated liver enzymes are a key diagnostic criterion for this condition. The syndrome indicates a severe form of preeclampsia with liver involvement. Next question. A patient at a family planning clinic is suspected of having a sexually transmitted infection. Which test is the most accurate for diagnosing treponema pallidum? A. Venereal disease research laboratory test. B. Fluorescent treponemal antibody. C. Thayer-Martin culture. D. Rapid plasma regin. Think about the most specific tests for syphilis. The correct answer is B. Fluorescent treponemal antibody. The fluorescent treponemal antibody test specifically detects antibodies to treponema pallidum, the bacteria causing syphilis, making it a definitive diagnostic tool for this infection. The fluorescent treponemal antibody absorption test checks for the presence of antibodies, confirming syphilis infection. Let's continue. Which condition puts a person diagnosed with human papillomavirus at a higher risk? A. Cervical cancer. B. Multiple myeloma. C. Hodgkin's lymphoma. D. Ovarian cancer. Consider the complications associated with human papillomavirus. The correct answer is A. Cervical cancer. Human papillomavirus significantly increases the risk of cervical cancer. Certain strains of human papillomavirus are directly linked to cancerous changes in cervical cells. Human papillomavirus is the initiating force behind multiple epithelial lesions and cancers, particularly of the anogenital region. Subtypes 16 and 18 are high risk for progressing to malignancies. A patient, appearing disoriented, tells the nurse, "I haven't eaten anything all day. When will breakfast be served?" The nurse recalls seeing this patient having breakfast with others in the day room just 30 minutes ago. What should the nurse say? A. I apologize that you missed breakfast. I'll inform the charge nurse. B. You'll need to wait a bit. Lunch will be served soon. C. Let me bring you some juice and toast. Would you like anything else? D. You already had breakfast half an hour ago. Consider the best approach to managing a confused patient. The correct answer is C. Let me bring you some juice and toast. Would you like anything else? For patients with confusion who may forget eating, it's best not to confront their faulty memory. Providing a small meal can calm them until the next scheduled meal. Confronting their incorrect beliefs can cause defensiveness and stress. It's important to avoid challenging illogical thinking, as it can lead to a defensive reaction. Instead, meeting the immediate need helps maintain normal nutrition and hydration. All right, next one. A woman in active labor is admitted to the maternity ward. During an examination, the nurse observes a raised lesion on the perineum. What should the nurse do first? A. Note the finding in the chart. B. Continue with the standard care plan. C. Get the patient ready for a cesarean section. D. Inform the doctor immediately. Think about the potential implications of this finding. The correct answer is D. Inform the doctor immediately. A lesion on the perineum could indicate herpes, which may necessitate a cesarean section to prevent transmitting the infection to the newborn. Proper diagnosis and management are crucial in such scenarios. Reporting the finding to the doctor allows for timely intervention, such as antiviral treatment and delivery planning. When monitoring a patient receiving intravenous magnesium sulfate, what is an expected side effect? A. Decreased urinary output. B. Loss of knee-jerk reflex. C. Extreme sleepiness. D. Slower breathing rate. Think about the common side effects of magnesium sulfate. The correct answer is C. Extreme sleepiness. Patients on magnesium sulfate often experience hypersomnolence, hot flashes, and lethargy. Minor side effects such as facial flushing and warmth are common and typically resolve without intervention. When evaluating a patient with preeclampsia, how should a nurse assess the biceps reflex? A. The nurse should hold the patient's arm loosely in one hand and tap the back of the elbow with a reflex hammer. B. The nurse should have the patient dangle her legs and strike just below the kneecap with the blunt side of a reflex hammer. C. The nurse should ask the patient to keep her arms relaxed at her sides and tap the area just above the wrist with a reflex hammer. D. The nurse should place their thumb on the tendon in the antecubital fossa and strike the thumb with a reflex hammer. Think about the proper technique for assessing reflexes. The correct answer is D. The nurse should place their thumb on the tendon in the antecubital fossa and strike the thumb with a reflex hammer. The biceps reflex is assessed by positioning your thumb on the biceps tendon and tapping your thumb with a reflex hammer to observe arm movement. This technique helps to evaluate the functionality of the reflexes in all 4 limbs. For a patient with pancreatic cancer, which nursing diagnosis is the highest priority? A. Ineffective coping. B. Skin integrity issues. C. Nutrition imbalance. D. Bowel elimination issues. Consider the primary concerns for a patient with this condition. The correct answer is C. Nutrition imbalance. Pancreatic cancer often leads to severe nausea, vomiting, and weight loss, making nutrition a primary concern. Maintaining adequate nutrition is critical for these patients. A patient chooses epidural anesthesia for labor pain relief. If she becomes hypotensive, what should the nurse do first? A. Administer oxygen via nasal cannula. B. Slow the intravenous infusion rate. C. Place her in a head-down position. D. Increase the intravenous infusion rate. Think about the immediate interventions for hypotension. The correct answer is D. Increase the intravenous infusion rate. In the event of hypotension after epidural anesthesia, the nurse should turn the patient to her left side, administer oxygen by mask, and increase the intravenous infusion rate. If the blood pressure does not stabilize, the physician should be contacted, and epinephrine should be on hand for emergencies. A newborn of a diabetic mother shows several behaviors. Which one should prompt the nurse to take immediate action? A. Yawning. B. Periods of wakefulness. C. Trembling. D. Frequent crying. Consider the signs of neonatal distress. The correct answer is C. Trembling. Trembling in a newborn can indicate seizures or hypoglycemia, conditions that need urgent medical attention. Management includes maintaining blood glucose levels above 2.5 millimoles per liter, often starting with an intravenous glucose bolus, followed by continuous infusion. A diabetic primigravida at 34 weeks gestation is admitted to labor and delivery. Which of the doctor's orders should the nurse verify? A. Magnesium sulfate, 4 grams. B. Cefazolin 2 grams intravenous piggyback every 6 hours. CC, butorphanol, 1 milligram, intravenous push every 4 hours as needed for pain. D. Terbutaline 10 micrograms intravenous. Think about the potential effects of these medications. The correct answer is D. Terbutaline 10 micrograms intravenous. Terbutaline is used with caution in diabetic patients as it can increase blood glucose levels. It may also cause temporary increases in the fetal heart rate and blood sugar levels, raising concerns about its long-term use. For a patient with ascites, what is the most accurate method for early detection? A. Visual inspection of the abdomen. B. Checking for a fluid wave. C. Palpating for an enlarged liver. D. Measuring abdominal girth daily. Think about the best methods for tracking changes in ascites. The correct answer is D. Measuring abdominal girth daily. Daily measurement of abdominal girth with a paper tape measure is the most objective and reliable method for early detection of ascites, which involves the accumulation of fluid in the peritoneal cavity. A client arrives at the emergency department after a car accident. Vital signs: blood pressure 84/36, pulse 125, respirations 18. What is the priority nursing diagnosis? A. Sensory perception alteration. B. Impaired cerebral tissue perfusion. C. Ineffective airway clearance. D. Deficient fluid volume. Consider the most critical issue based on the vital signs. The correct answer is D. Deficient fluid volume. The vital signs indicate hypovolemic shock, making fluid volume deficit the priority diagnosis. The nurse should monitor vital signs closely, particularly blood pressure and heart rate, and manage the fluid volume accordingly. A multigravida with diabetes is scheduled for an amniocentesis at 32 weeks to check the lecithin-sphingomyelin ratio and phosphatidylglycerol level. The lecithin-sphingomyelin ratio is 1:1, and phosphatidylglycerol is present. How should the nurse interpret these results? A. The infant is at high risk for intrauterine growth restriction. B. The infant has a low risk of congenital anomalies. C. The infant is at high risk for birth trauma. D. The infant is at high risk for respiratory distress syndrome. Think about the significance of the lecithin-sphingomyelin ratio in fetal lung maturity. The correct answer is D. The infant is at high risk for respiratory distress syndrome. A lecithin-sphingomyelin ratio of 2:1 generally indicates mature fetal lungs. A ratio of 1:1 suggests immaturity and a higher risk for respiratory distress syndrome. The presence of phosphatidylglycerol supports this assessment. During a home visit, which activity of an 18-year-old with osteogenesis imperfecta causes the most concern? A. Consuming several carbonated drinks daily. B. Taking acetaminophen for pain. C. Having 2 sisters with sickle cell trait. D. Enjoying playing football. Consider the risks associated with osteogenesis imperfecta. The correct answer is D. Enjoying playing football. Patients with osteogenesis imperfecta are prone to fractures, and contact sports like football increase the risk of serious injury. Activities should be carefully selected to prevent fractures. A patient who had a laryngectomy becomes unresponsive and pale with a blood pressure of 90/40. What should the nurse do first? A. Put the patient in Trendelenburg position. B. Increase the dextrose in normal saline infusion rate. C. Administer intravenous atropine. D. Bring the emergency cart to the bedside. Think about the immediate intervention for low blood pressure. The correct answer is B. Increase the dextrose in normal saline infusion rate. For a patient with such low blood pressure, increasing the infusion rate of dextrose in normal saline helps stabilize the blood pressure by providing necessary fluids and electrolytes. Post-operative complications like bleeding and airway issues need close monitoring and immediate action. A pregnant woman at 4 months needs to increase her calcium intake. Which food is the best option? A. Yogurt. B. Granola bar. C. Bran muffin. D. Fruit juice. Think about the best sources of calcium. The correct answer is A. Yogurt. Yogurt contains around 400 milligrams of calcium per cup, making it an excellent source for pregnant women to support fetal development and prevent bone density loss in the mother. A nurse is managing a preeclamptic patient with a magnesium sulfate order. Which action shows the nurse's understanding of the medication's side effects? A. Inserting a Foley catheter. B. Keeping a padded tongue blade at the bedside. C. Posting a sign to avoid blood pressure measurement in the right arm. D. darkening the room. Consider the side effects of magnesium sulfate. The correct answer is A. Inserting a Foley catheter. Magnesium sulfate can lead to decreased urine output, so a Foley catheter is essential for accurate monitoring of urinary output. Proper intake and output monitoring are crucial in preventing complications. A nurse is tending to a patient in the organ transplant unit who has a low white blood cell count. A visitor arrives with a basket of fresh fruit during the evening visiting hours. What should the nurse do? A. Request the family to take the fruit home. B. Place the fruit basket next to the patient's bed for easy access. C. Offer to wash the fruit for the patient. D. Allow the patient to keep the fruit basket. Consider the infection risk for immunocompromised patients. The correct answer is A. Request the family to take the fruit home. Patients with neutropenia are at a higher risk of infection. Fresh fruits can harbor bacteria, and it is safer for such patients to avoid them. Instead, fruits should be cooked or peeled to minimize the risk. Additionally, the nurse should remove any potted or cut flowers from the room to reduce potential sources of bacteria. A 6-year-old patient with a hemoglobin level of 6 grams per deciliter needs a blood transfusion, but the mother refuses due to her beliefs. What should the nurse do? A. Inform the physician about the mother's refusal. B. Urge the mother to reconsider. C. Explain the consequences of refusing treatment. D. Ask the mother to step out during the transfusion. Think about the best approach to handling the situation. The correct answer is A. Inform the physician about the mother's refusal. The nurse must notify the physician of the mother's refusal to proceed with the blood transfusion. The physician can discuss the medical necessity and potential consequences with the mother and consider legal options if necessary, given the child's minor status. All right, let's start next question. A patient with facial burns from an explosion is admitted. What is the nurse's primary concern? A. Swelling of the larynx. B. Low blood volume. C. High potassium levels. D. High sodium levels. Take a moment to think about it. Remember, airway management is crucial in burn patients. Got your answer? The correct answer is A. Swelling of the larynx. Laryngeal edema is a critical concern because it can obstruct the airway. Ensuring the airway remains clear and addressing any respiratory issues promptly is paramount in burn patients. Next question. A patient on sodium warfarin has a pro time of 120 seconds. What is the priority nursing intervention? A. Monitor for signs of unusual bleeding. B. Educate the patient about medication therapy. C. Increase the frequency of neurological assessments. D. Prepare for an increased dosage of Coumadin. Think about the risks associated with prolonged clotting times. Ready? The correct answer is A. Monitor for signs of unusual bleeding. A pro time of 120 seconds indicates significantly prolonged clotting time, posing a high risk of spontaneous bleeding. The nurse must vigilantly monitor for symptoms like unusual bruising, nosebleeds, or dark stools to prevent serious complications. Let's move on. A patient, 2 days post-lung surgery, accidentally removes their chest tube. What is the nurse's immediate action? A. Cover the site with a Vaseline gauze. B. Order a chest X-ray. C. Reinsert the chest tube. D. Notify the doctor immediately. Think about the priority in preventing complications. The correct answer is A. Cover the site with a Vaseline gauze. The priority is to cover the insertion site with an occlusive dressing like Vaseline gauze to prevent air from entering the pleural space, which could cause a pneumothorax. The nurse should then call the doctor for further instructions and possible reinsertion of the chest tube. All right, next one. After a tibia fracture repair and cast application, which symptoms should the nurse report to the doctor? A. Tingling or numbness in the toes. B. Pain under the cast. C. Warm toes. D. Weak and rapid pulse in the feet. Consider the signs of compartment syndrome. The correct answer is A. Tingling or numbness in the toes. Paresthesia indicates possible compartment syndrome, a serious condition that requires immediate intervention to prevent permanent tissue damage. How does a nurse determine the effectiveness of a care plan for a patient with anorexia nervosa? A. Patient gains weight. B. Improvement in hemoglobin and hematocrit levels. C. Better skin turgor. D. Patient chooses a balanced diet from the menu. Think about the primary goal in treating anorexia nervosa. The correct answer is A. Patient gains weight. Weight gain is the most direct and measurable indicator of improvement in a patient with anorexia nervosa, showing that the nutritional interventions are effective. A patient recovering from pneumonia is preparing for discharge. Which statement by the family requires further clarification? A. We will encourage him to use the incentive spirometer to help keep his lungs clear. B. We will make sure he avoids any strenuous activities and gets plenty of rest. C. He can stop taking his antibiotics once he feels better. D. He can start eating a regular diet, focusing on healthy, nutritious foods. Think about the importance of completing medication courses. Ready? The correct answer is C. He can stop taking his antibiotics once he feels better. Patients must complete their prescribed course of antibiotics to ensure the infection is fully eradicated and to prevent the development of antibiotic-resistant bacteria. Stopping antibiotics early can lead to recurrence or worsening of the infection. The charge nurse on a cardiac unit is assigning patients. Which patient is most appropriate for a float nurse from labor and delivery? A. A patient with unstable angina requiring frequent pain assessments and medication adjustments. B. A newly admitted patient with a suspected myocardial infarction on continuous telemetry. C. A post-operative valve replacement patient admitted due to lack of surgical beds. D. A patient who had coronary bypass surgery a week ago and is preparing for discharge. Consider the level of care required for each patient. The correct answer is D. A patient who had coronary bypass surgery a week ago and is preparing for discharge. A patient who is 1 week post-coronary bypass and preparing for discharge requires less intensive care and more routine monitoring, making this assignment appropriate for a float nurse from labor and delivery who may not have specialized cardiac experience. Next question. A newly diagnosed 8-year-old with type 1 diabetes and his mother are receiving discharge education. The mother asks about the purpose of glucagon. What is the nurse's correct response? A. Glucagon treats lipoatrophy from insulin injections. B. Glucagon is used to treat severe low blood sugar when your child is unconscious. C. Glucagon is used to extend the duration of insulin action. D. Glucagon is used to lower blood sugar if it becomes too high. Think about the emergency use of glucagon. The correct answer is B. Glucagon is used to treat severe low blood sugar when your child is unconscious. Glucagon is an emergency medication used to treat severe hypoglycemia in diabetic patients, especially when the patient is unconscious or unable to take oral glucose. It works by stimulating the liver to release stored glucose into the bloodstream, quickly raising blood sugar levels. Let's move on. A patient diagnosed with chickenpox is likely to be prescribed which type of medication? A. Acetaminophen. B. Amoxicillin. C. Warfarin. D. Acyclovir. Think about the best treatment for viral infections like chickenpox. The correct answer is D. Acyclovir. Chickenpox, caused by the varicella-zoster virus, is best managed with antiviral medications like acyclovir. This drug reduces the severity and duration of symptoms if started within 24 to 48 hours of rash onset. It is particularly important for adults who may experience more severe complications from chickenpox. Next one. A nurse is caring for a terminally ill Vietnamese patient whose family is performing traditional rituals and bringing cultural foods. What should the nurse do? A. Arrange for a private room if possible to accommodate the family's practices. B. Limit the number of visitors and visiting hours to 2 at a time. C. Inform the family that only hospital-provided food is allowed. D. Notify hospital administration about the family's activities. Think about respecting cultural practices. The correct answer is A. Arrange for a private room if possible to accommodate the family's practices. Providing a private room allows the family to perform traditional rituals and bring cultural foods, respecting their cultural practices and providing comfort during a difficult time. This approach helps maintain a supportive and culturally sensitive environment. A patient admitted with chest pain should avoid which of the following medications? A. Atenolol. B. Vancomycin. C. Diltiazem. D. Nitroglycerin. Think about the medications that are not indicated for chest pain. The correct answer is B. Vancomycin. Chest pain related to cardiac issues typically requires medications that improve blood flow, reduce heart workload, or control heart rate. Vancomycin, an antibiotic, has no role in treating chest pain unless there's a specific indication of a bacterial infection. All right, moving on. Which of the following instructions should be included in the teaching for a patient with rheumatoid arthritis? A. Avoid any form of exercise. B. Take prescribed anti-inflammatory medications with meals. C. Completely avoid all physical activity. D. Use cold packs only on affected joints. Think about the management of rheumatoid arthritis. The correct answer is B. Take prescribed anti-inflammatory medications with meals. Anti-inflammatory medications should be taken with meals to minimize gastrointestinal upset. These medications help reduce inflammation and pain associated with rheumatoid arthritis and are essential for managing the condition effectively. Next one. A patient with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should the nurse question? A. Morphine intramuscular as needed for pain. B. Meperidine intramuscular as needed for pain. C. Aluminum hydroxide and magnesium hydroxide via nasogastric. D. Ranitidine by mouth 4 times a day. Consider the medications that could exacerbate pancreatitis. The correct answer is A. Morphine intramuscular as needed for pain. Morphine can cause spasms of the sphincter of Oddi, exacerbating pain in patients with pancreatitis. Therefore, it is generally contraindicated in these patients. Next question. A patient arrives at the emergency department with severe chest pain. What should the nurse prioritize? A. Administer prescribed pain relief medication. B. Assess vital signs and initiate intravenous access. C. Conduct a detailed medical history. D. Perform an electrocardiogram immediately. Think about the initial steps in managing chest pain. The correct answer is B. Assess vital signs and initiate intravenous access. The priority nursing action for a patient presenting with chest pain is to assess their vital signs to evaluate their immediate physiological status and initiate intravenous access for potential emergency interventions. This allows for quick administration of life-saving medications if needed. A patient is admitted to a substance abuse unit with an order for continuous observation. The nurse is aware that the doctor has ordered continuous observation because A. Hallucinogenic drugs produce severe respiratory depression. B. Hallucinogenic drugs create both stimulant and depressant effects. C. Hallucinogenic drugs induce a state of altered perception. D. Hallucinogenic drugs induce rapid physical dependence. Think about the effects of hallucinogenic drugs. The correct answer is C. Hallucinogenic drugs induce a state of altered perception. hallucinogenic. Drugs cause altered perceptions, including visual and auditory hallucinations, which can lead to unpredictable and potentially dangerous behaviors. Continuous observation ensures patient safety during withdrawal. Next one. Which nursing action is most crucial for a cancer patient receiving subcutaneous morphine for pain? A. Check urine output. B. Monitor respiratory rate. C. Assess heart rate. D. Measure body temperature. Consider the primary side effects of morphine. The correct answer is B. Monitor respiratory rate. Morphine can suppress respiration, making it critical to monitor the respiratory rate to prevent respiratory compromise. Next question. A patient with severe lower leg pain after a fall needs immediate assessment. What is the appropriate next step? A. Apply heat to the area. B. Wrap the leg with an elastic bandage. C. Perform an X-ray. D. Administer pain medication. Think about the diagnostic steps following a traumatic injury. The correct answer is C. Perform an X-ray. An X-ray is essential to determine if there is a fracture, guiding further treatment. All right, moving on. A patient taking phenytoin for seizures experiences breakthrough episodes. Which serum drug level would indicate a subtherapeutic level? A. 15 micrograms per milliliter. B. 4 micrograms per milliliter. C. 10 micrograms per deciliter. D. 5 micrograms per deciliter. Consider the therapeutic range for phenytoin. The correct answer is B. 4 micrograms per milliliter. A level of 4 micrograms per milliliter is below the therapeutic range, indicating that the patient may not be receiving enough medication to control seizures effectively. Next up, which symptom would indicate that an infant's diuretic dosage for congestive heart failure may need to be increased? A. Sudden weight gain. B. Lowered blood pressure. C. Shallow, slow breathing. D. Decreased heart rate. Think about the signs of fluid retention in infants. The correct answer is A. Sudden weight gain. Sudden weight gain is an indicator of fluid retention, a common sign that the current diuretic dosage is insufficient for managing the infant's heart failure. The accumulation of fluid increases the heart's workload and can lead to worsening heart failure symptoms. A patient reports taking excessive acetaminophen for back pain relief. Which symptom suggests acetaminophen toxicity? A. Ringing in the ears. B. Diarrhea. C. High blood pressure. D. Liver damage. Think about the primary organ affected by acetaminophen toxicity. The correct answer is D. Liver damage. Liver damage is a serious and common consequence of acetaminophen overdose, requiring immediate medical attention. What is the appropriate action for a patient with a rapidly enlarging abdominal aortic aneurysm? A. Admit for observation and medication. B. Admit to day surgery for sclerotherapy. C. Admit to surgical unit for resection. D. Discharge with cardiologist follow-up. Think about the urgency of treating an enlarging aneurysm. The correct answer is C. Admit to surgical unit for resection. Immediate surgical intervention is necessary to prevent rupture. Next up, which patient is most likely to require an automatic internal cardioverter defibrillator? A. Recent myocardial infarction with no muscle damage. B. Post-coronary bypass with normal recovery. C. History of ventricular tachycardia and syncopal episodes. D. History of atrial tachycardia with fatigue. Consider the patients at highest risk for sudden cardiac death. The correct answer is C. History of ventricular tachycardia and syncopal episodes. Ventricular tachycardia with syncopal episodes poses a high risk for sudden cardiac death, making an automatic internal cardioverter defibrillator necessary. Next question. A leukemia patient on chemotherapy has a platelet count of 25,000 per microliter. What action should be included in the care plan? A. Monitor for fever regularly. B. Require visitors to wear masks and protective clothing. C. Consider transfusion of red blood cells. D. Check for signs of bleeding, including urine and stool examination. Think about the complications of low platelet counts. The correct answer is D. Check for signs of bleeding, including urine and stool examination. Low platelet counts increase the risk of bleeding, necessitating close monitoring for bleeding signs. All right, next one. Which condition contraindicates magnetic resonance imaging for a patient with suspected lung cancer? A. Shellfish allergy. B. Presence of a pacemaker. C. Claustrophobia. D. Use of antipsychotic medication. Think about the safety considerations for magnetic resonance imaging. The correct answer is B. Presence of a pacemaker. Pacemakers can be disrupted or damaged by the magnetic fields in a magnetic resonance imaging. Next question. A nurse suspects a patient has developed a pulmonary embolism. Which symptom is most indicative? A. Decreased responsiveness. B. Sudden chest pain and shortness of breath. C. Wet cough with lung crackles. D. Fever with chills and appetite loss. Think about the classic signs of a pulmonary embolism. The correct answer is B. Sudden chest pain and shortness of breath. Sudden onset of chest pain and shortness of breath are classic signs of a pulmonary embolism. Let's kick things off with next question. A patient suspected of having Hodgkin's disease presents with symptoms. Which symptom is characteristic of this condition? A. Weight gain. B. Painful cervical lymph nodes. C. Night sweats and fatigue. D. Nausea and vomiting. Think about the systemic symptoms often seen with this condition. Ready? The correct answer is C. Night sweats and fatigue. Hodgkin's disease often presents with systemic symptoms like night sweats, fatigue, fever, and unintentional weight loss. Weight gain and nausea, vomiting are not typical, and lymph nodes are usually painless. Next question. A nurse is caring for a patient with acute lymphoblastic leukemia, ALL. Which age range is most commonly affected by this disease? A. 45 to 55 years. B. 25 to 35 years. C. Over 60 years. D. 3 to 10 years. Think about the demographics most affected by ALL. The correct answer is D. 3 to 10 years. ALL predominantly affects children, especially between the ages of 3 and 10. It is the most common childhood cancer, unlike other types of leukemia more common in adults. Let's move on. A leukemia patient is in the initial phase of treatment. Which of the following family comments indicates a need for more instruction regarding infection precautions? A. We plan to bring fresh flowers to cheer up the room. B. We plan to bring books and magazines for entertainment. C. We plan to bring personal care items for the patient's comfort. D. We plan to bring family photos and get well cards. Think about what could pose an infection risk. The correct answer is A. We plan to bring fresh flowers to cheer up the room. Patients undergoing leukemia treatment are extremely susceptible to infections. Fresh flowers can carry harmful microbes and should be avoided to protect the patient's weakened immune system. Books, magazines, and sanitized personal care items are safer options. Next up, a lymph node biopsy is performed on a patient suspected of having Hodgkin's disease. Which cell type confirms the diagnosis? A. Reed-Sternberg cells. B. Gaucher's cells. C. Lymphoblastic cells. D. Reeder's cells. Think about the hallmark cells of Hodgkin's disease. The correct answer is A. Reed-Sternberg cells. The presence of Reed-Sternberg cells in lymph node tissue confirms Hodgkin's disease. Gaucher's cells, lymphoblasts, and Reader's cells are associated with other conditions. All right, here's the next one. A patient is anxious and fearful about an upcoming bone marrow biopsy. What is the most appropriate nursing intervention? A. Suggest the family stay in the room to provide emotional support. B. Inform the patient that any movement will intensify the pain. C. Postpone the procedure until the patient feels more comfortable. D. Stay with the patient and practice slow, deep breathing exercises together. Consider the best way to ease the patient's anxiety. The correct answer is D. Stay with the patient and practice slow, deep breathing exercises together. Guiding the patient through deep breathing exercises can help reduce anxiety and stress, promoting relaxation. Family presence might add stress, and delaying the procedure does not address the anxiety effectively. Next question. A mother is concerned that her 30-month-old son has not yet mastered toilet training, particularly with urine control. What is the nurse's best response? A. The child should be disciplined each time he wets to learn that the behavior is inappropriate. B. It's common for bowel control to be achieved before bladder control, and children vary widely in when they complete toilet training, typically between 24 and 36 months. C. Bladder control usually comes before bowel control. The child should stay on the potty until urinating. D. The child should be trained by age 2 and may need evaluation for developmental issues. Think about the normal timeline for toilet training. The correct answer is B. It's common for bowel control to be achieved before bladder control, and children vary widely in when they complete toilet training, typically between 24 and 36 months. Bowel control often precedes bladder control in toddlers, and the timeline for completing toilet training varies widely among children. Negative reinforcement can hinder the training process. All right, next one. A 14-month-old child cannot sleep without a bottle of milk and wakes up during the night asking for more. What should the nurse recommend? A. Provide only a bottle of water at bedtime. B. Allow the bottle at bedtime but not during the night. C. Remove all bottles from the crib. D. Substitute milk with juice in the bottle. Think about the best way to prevent dental decay. The correct answer is A. Provide only a bottle of water at bedtime. Using a bottle of water can prevent dental decay caused by sugars in milk or juice while still providing the child comfort. Gradually transitioning to water is a more gentle approach than abruptly removing all bottles. Next question. Which action is inappropriate when caring for a 3-month-old infant? A. Let the infant cry for 10 minutes before responding if they wake up during the night. B. Talk to the infant frequently and maintain eye contact to promote language development. C. Introduce infant cereals and strained fruits at 4 months. D. Place the infant on their back for naps and bedtime. Think about the needs of a 3-month-old infant. The correct answer is A. Let the infant cry for 10 minutes before responding if they wake up during the night. Infants under 6 months often need to feed during the night due to small stomach capacity, so prompt response to their needs is important for their development. Frequent talking and eye contact help in developing language and bonding. Let's move on. An elderly patient seeks advice on preventing constipation. Which suggestions are helpful? Select all that apply. A. Use a mild laxative daily to ensure regular bowel movements. B. Drink 6 to 8 glasses of water daily. C. Engage in daily moderate exercise for at least 30 minutes. D. Eat a high-fiber diet. E. Follow a protein-rich diet. Consider the best ways to promote healthy bowel movements. The correct answers are B, C, and D. Regular exercise, adequate fluid intake, and a high-fiber diet all promote healthy bowel movements and prevent constipation. Laxatives should be used sparingly to avoid dependency, and a balanced diet with sufficient fiber is essential. Next question. A child is admitted with suspected rheumatic fever. Which of the following findings would not support the diagnosis? A. A recent history of sore throat that resolved. B. An unexplained fever. C. A negative anti-streptolysin O titer. D. A red rash visible over the trunk and extremities. Think about the diagnostic indicators for rheumatic fever. The correct answer is C. A negative anti-streptolysin O titer. Rheumatic fever is typically confirmed with a positive anti-streptolysin O titer, indicating a recent streptococcal infection. A history of sore throat, fever, and a red rash are common symptoms. All right, moving on. Which discharge instruction is correct for a patient with peripheral artery disease? A. Avoid crossing legs. B. Use a heating pad to warm feet. C. Treat skin lesions with home remedies. D. Walk barefoot frequently. Think about how to improve circulation and prevent complications. The correct answer is A. Avoid crossing legs. Crossing the legs can impede blood flow, worsening the condition. Heating pads can cause burns, skin lesions should be treated by a physician, and walking barefoot increases the risk of injury. Next question. What car safety advice should a nurse give to parents taking their newborn home? A. A parent can hold the newborn in the back seat. B. Secure the infant in a rear-facing car seat in the back seat. C. Use a car seat facing forward or rearward in the back seat. D. Secure the infant in a front passenger seat car seat. Think about the safest way to transport a newborn. The correct answer is B. Secure the infant in a rear-facing car seat in the back seat. Infants under 1 year should be in a rear-facing car seat in the back seat for maximum safety. Holding the baby in the car is unsafe and illegal, and the front seat is unsafe due to airbag risks. All right, next one. Who should avoid taking alendronate, also known as Fosamax, for osteoporosis? A. Someone allergic to shellfish. B. A patient confined to bed who cannot sit upright. C. A woman taking medication for high blood pressure. D. A patient following a low-calorie diet. Think about the administration requirements for alendronate. The correct answer is B. A patient confined to bed who cannot sit upright. Alendronate can cause esophageal irritation and should not be taken if the patient cannot stay upright for at least 30 minutes after ingestion. Shellfish allergy, high blood pressure medication, and a low-calorie diet do not affect alendronate usage. Next question. Tissue plasminogen activator, also known as TPA, is considered for stroke treatment. Which is a contraindication? A. Previous stroke. B. History of brain hemorrhage. C. High blood pressure. D. Severe chest pain. Think about the risks associated with TPA. The correct answer is B. History of brain hemorrhage. TPA increases bleeding risk, so a history of brain hemorrhage is a contraindication. Previous stroke needs evaluation, high blood pressure needs monitoring, and chest pain alone does not contraindicate TPA use. All right, next one. A patient with a suspected heart attack progresses to cardiogenic shock. What symptoms should the nurse expect? A. Slow heart rate. B. High blood pressure. C. Confusion. D. Strong pulse. Think about the effects of reduced blood flow to the brain. The correct answer is C. Confusion. Cardiogenic shock reduces blood flow to the brain, leading to confusion. A fast heart rate, low blood pressure, and weak pulse are more common than their opposites. Next question. Which observation suggests measles, also known as rubeola, in a non-immunized child? A. Mild fever. B. White spots in the mouth. C. Rash starting on the trunk. D. Fluid-filled blisters. Think about the hallmark symptoms of measles. The correct answer is B. White spots in the mouth. Koplik spots are characteristic of measles, appearing in the mouth. High fever, a rash starting on the face and spreading downward, and fluid-filled blisters are seen in chickenpox, not measles. All right, let's continue. A 2-month-old has one testis palpable in the scrotum. What is the most accurate statement about undescended testis? A. Testes normally descend by 1 year of age. B. Testes normally descend by birth. C. The infant probably has only one testis. D. Surgery is likely needed. Think about the normal timeline for testis descent. The correct answer is A. Testes normally descend by 1 year of age. Tests usually descend by 1 year. It is common for tests to retract temporarily due to cold or reflexes in infants. Surgery is considered if testes do not descend by 1 year. Next question. A 13-year-old is excused from sports due to Osgood-Schlatter disease. Which statement is correct? A. Avoiding physical education. B. Pain below the knee. C. Usually needs surgery. D. Caused by excessive swimming. Think about the symptoms and management of Osgood-Schlatter disease. The correct answer is B. Pain below the knee. Osgood-Schlatter disease involves pain and swelling below the knee due to repetitive stress on the growth plate. It is managed with rest, not surgery, and is caused by activities like running or jumping, not swimming. Next one. Which facts about claudication are correct? Select all that apply. A. Pain occurs mostly at rest. B. Causes cramping and weakness. C. Relieved after stopping exercise. D. Results from inadequate oxygen in tissues. E. Caused by poor blood flow during exercise. Think about the symptoms and causes of claudication. The correct answers are B, C, D, and E. Claudication occurs when activity increases oxygen demand in muscles beyond supply, causing hypoxia, cramping, and weakness, relieved by rest. Pain occurs during activity, not at rest. All right. A patient returns to the emergency room after getting a plaster cast for a fractured right radius. Which symptoms should concern the nurse about impaired blood flow to the limb? A. Severe pain in the lower part of the right arm. B. Intense itching beneath the cast. C. Severe pain in the shoulder. D. Increased warmth in the fingertips. Think about signs of impaired blood flow. The correct answer is A. Severe pain in the lower part of the right arm. Severe pain in the lower arm may indicate compromised blood flow due to increased compartment pressure, necessitating immediate intervention. Itching is common and generally harmless, and shoulder pain is not related to lower arm blood flow issues. Next question. A patient post-heart attack is advised to exercise. Why? A. Prevents constipation. B. Prevents blood clots. C. Increases fitness and prevents future heart attacks. D. Prevents bed sores. Think about the immediate benefits of exercise post-heart attack. The correct answer is B. Prevents blood clots. Exercise promotes circulation and helps prevent deep vein thrombosis, also known as DVT, keeping blood flow active. While exercise can also improve fitness and prevent constipation or bed sores, the primary goal here is clot prevention. All right, next one. A nurse checks an intravenous site in a patient receiving fluids and medications. Which finding requires immediate action to remove the intravenous line? A. Intravenous fluid is infusing too slowly when the arm is elevated. B. A small bruise is visible near the intravenous site. C. Patient reports pain when moving the arm. D. Area around the intravenous site is red, warm, and painful. Think about signs of intravenous complications. The correct answer is D. Area around the intravenous site is red, warm, and painful. These symptoms indicate phlebitis, and the intravenous line should be discontinued and a new site chosen to prevent further complications. Slow infusion may need flushing or repositioning, and a small bruise is common and usually not a reason to remove the line. Next question. A nurse administers intravenous furosemide to a heart failure patient. Which symptom is not expected after infusion? A. Lowered blood pressure. B. Increased urine output. C. Reduced edema. D. Decreased pain. Think about the primary effects of furosemide. The correct answer is D. Decreased pain. Furosemide reduces fluid overload, increasing urine output, lowering blood pressure, and reducing edema, but does not directly affect pain. All right, let's continue. Which is a modifiable risk factor for coronary artery disease? A. Age. B. Obesity. C. Gender. D. Heredity. Think about which factors can be changed through lifestyle. The correct answer is B. Obesity. Obesity can be managed through diet and exercise, reducing the risk of coronary artery disease. Age, gender, and heredity are non-modifiable factors. Last question for today. A 27-week pregnant woman on bed rest suddenly has chest pain and shortness of breath. What is the most likely cause? A. Anxiety. B. Blood clot in the lung. C. Fluid overload. D. Heart attack. Think about the risks associated with prolonged bed rest. The correct answer is B. Blood clot in the lung. Prolonged bed rest and pregnancy increase the risk of deep vein thrombosis, which can lead to pulmonary embolism causing these symptoms. Anxiety is possible, but the risk of pulmonary embolism is higher.